Hello friends, today I'm going to discuss about predicting violence, part 2, risk assessment and management. I've already made a first video on predicting violence. If you have not seen the first video, please watch that video and then only see this video. I'm Dr. Suresh Badadmat, Professor of Psychiatry, working at NIMANS, Bangalore. Before I start my presentation, I would like to place this disclaimer. This presentation is for academic and training purpose only. For legal opinion, please do contact an advocate. For clinical opinion, please do contact a psychiatrist. Conflict of interest? None. In this video, I'm going to discuss about very important aspects of predicting violence. First is, can we predict violence? What are the trigger for assessment of violence or risk assessment for violence? Types of risk assessment? And what is the best method to do risk assessment? These are the 4 important points I'm going to discuss in this video. This video is targeted to psychiatrists, doctors, nurses, mental health professionals, psychiatric social worker, clinical psychologist, and medical social workers. They are going to benefit by watching this video. Can we predict violence? As I already discussed in the first video, it is very difficult to predict violence accurately. At this point of time, on today's date, it is simply impossible to predict violence accurately. What a psychiatrist can do is, he will be able to assess the risk. That is, the probability of occurring an event can be estimated. That is risk assessment. That means we will be able to assess whether the person has high risk, moderate risk, or low risk for violence. Let me repeat. Violence cannot be predicted accurately, but risk assessment can be done. Risk assessment can be categorized depending upon the number of risk factors a person has, whether he falls into mild category of risk, moderate category of risk, or severe category of risk. Based upon this risk assessment, we can categorize, but we cannot predict violence. That means human behavior is very complex. It is simply difficult to predict a behavior, but we can categorize into different category of risk assessment. That means a risk is a hazard which is not completely understood and can't be predicted. Risk can only be forecasted with uncertainty. That means risk assessment is like weather forecast. And you need to understand risk is context specific, person specific, varies with time. That means risk for a person varies with the time. That means it is as dynamic as time. The time is not constant, it changes. Similarly, the risk for a given person changes depending upon the environment, depending upon the situation, depending upon the stress, depending upon the stimuli around him. So that means risk assessment need to be carried out, and it has to be context specific, time specific, and person specific. Risk is never accurately predicted. By identifying and doing a risk assessment, it carries various other important notions. It imbibes the nature of risk, the severity of risk, frequency, imminence, and likelihood, not just a probability of harm. That means the risk, when we do assessment, we will be answering all these questions. So what is risk assessment? Risk is simply or easily understood a probability of an event that may or may not occur, or likelihood of something happening is called as risk. So risk assessment, you need to understand the concept of risk. So when you understand this risk, we are able to identify it, define it, and assess it. Risk management and violence reduction intervention requires clear understanding of the causation. That means if you are able to identify the cause for violence, that means if you are able to mitigate the cause, then there will not be violence. As you see here, A causes the B. That means A leads to B. A is an event, B is a violence. If there is one important factor which leads to violence, if you are able to decrease that A, that means violence will not be there. But unfortunately, in human being, it does not happen. If there is A, at the same time, there are various factors. They are called as static factors. those will also play an important role. For example, Mr. A has various past history of substance use, past history of violence, he had undergone child sexual abuse, physical abuse, and he had a lot of conflict with law. They are all static factors which are in the past. At the same time, there are dynamic factors, current substance use, severe stress. So these both combination of dynamic factors and static factors will need to be. That means we need to understand the number of risk factors he has, number of dynamics factors he has, and which can be intervened so that A leading to B can be stopped or mitigated. That means risk assessment means risky human behavior. That means you are asking to assess something which is very difficult to assess, but a probability can be done. The probability how dangerous this person is, or how dangerous this person with mental illness is. What will happen if the treatment is given or if treatment is not given? Those assessment has to be done. So risk assessment is a balance between the rights of a person with mental illness versus rights of the community at large. There is a rights of a person with mental illness. We should treat him against his wish and will, or else if we don't treat him, will he go and attack people in the community? That means rights of the public at large. So we have to balance. That is the reason we have to do risk assessment. Risk assessment is basically the assessment between risk of having a poor outcome versus risk benefit of having a good thing. So it is benefit versus risk. So earlier mental health legislation, if you look at that, they considered dangerousness as the dangerous to self or others. But now the concept has changed. The concept is risk to self or others. So that paradigm shift you need to understand. So generally you need to understand the assessment will be done risk to harming others, risk to harming self, risk of self-neglect. That means he's not taking treatment, wandering aimlessly, poor personal hygiene, or else risk of destroying properties of others or self. So let's understand the risk management cycle. Risk management cycle has 5 important factors. Identification of a person who is risk and doing the screening and doing a thorough risk assessment, risk management, after doing the management, whether what is the intervention, and finally, we need to do periodic review and monitoring so that there is no relapse. So these 5 important can be understood in this cycle. So here, as I mentioned, you need to do the identification, screening, and do a thorough risk assessment, then do intervention, and also at the same time see what is the outcome and continuously monitor whether he is going to be or she is going to be risk further if there is a relapse. Now let's understand what are those factors which triggers this risk assessment. So what makes you to say, yes, we need to do a screening or else we need to do a thorough evaluation. Let's look into those triggers. The triggers means if there is a person has a risky high behavior. That means if a person is highly irritable, highly emotional, in such a scenario, you need to do the screening. Or else if you are going to deprive somebody's liberty. Imagine a person with mental illness is shouting. That means if you are doing to admit him in a closed ward, or else you are going to keep him against his wish and will inside the hospital, then you have to do the risk assessment. Or if you are restoring a liberty, that means if you are discharging a person with mental illness from the hospital, you need to confirm, yes, he has been treated, his mental illness is under control, and he does not have risk of harming himself or others. That when you are restoring the liberty, if the diagnosis, if you are suspecting this person is having borderline personality disorder, or else if he is having a severe mental disorder. And another important is forensic request from the court, request from the police, whether a person who has committed a crime has mental illness or not, before providing a bail for him or before providing a parole. Similarly, the risk assessment is also done if a person has mental illness and if he is going back to the job. Then you need to do fitness to job, fitness to stand trial. So these are all risk assessment of benefit versus risk. Similarly, insanity defense, if a person has claimed insanity defense and he has got insanity defense, before he is released into the community, you need to do risk assessment and check whether he continues to be violent or not. At the same time, if a person has completed his sentence and a person with mental illness prisoner, before he is left to the released into the community, we need to do risk assessment. So these are the triggers where we are going to do risk assessment. It is basically whenever you are having a touch base with the person with mental illness and you're depriving his liberty or restoring his liberty, you need to do risk assessment. Let's look at what are the assessment focus. That means if you are doing an assessment, is it the illness symptoms or else violence as the focus? So there are two important assessments is done as a risk assessment. One is just general assessment of mental illness or severity of illness. Second one is specific risk assessment. Risk assessment with regard to suicide, risk assessment regarding deliberate self-harm, fitness to job, fitness to use firearms if he is a soldier, fitness to stand trial or relapse of drug use, recidivism or reoffense. All those are specific risk assessment. So either you'll be doing general risk assessment or specific risk assessment you are doing. At the same time, you can also understand a different way of doing risk assessment. One is therapeutic risk assessment. That means you are doing intervention. You are going to do a treatment for admission or providing treatment. That is therapeutic risk assessment. Second one is forensic risk assessment. Forensic risk assessment is basically an assessment requested by the court or by the prison authority or by the legal authorities. So these are the two different things. Both of them have a different reason for requesting and the way we approach the patient or the client or the submission of report. Let's look at the different types of risk assessment. There are three important types of risk assessment. One is general clinical assessment, that is first generation. Second generation is actuarial assessment, that is the second one. Third one is structured clinical judgment. So let's look into each one of them, how they differ to each other, which one we have to choose. First, we'll be discussing about clinical assessment, that is the first generation. The first generation assessment is unstructured clinical assessment done by a psychiatrist or a psychologist or a social worker. It is done by a qualified psychiatrist. Here we will be taking about demographic details, chief complaints, history of presenting illness, history surrounding the need for risk assessment, life charting, family history of mental illness, violence, past history of violence, forensic history, if there is conflict with law, childhood truancy, stealing, lying, gang activities, personal history and risk factors, resilience factors, premorbid personality, serial mental status examination, cognitive function, ward observation, mini mental status examination, investigation and summary. Here you will be doing unstructured clinical assessment by a qualified clinician. That is clinical assessment. That is the first generation. The main criticism is it is unstructured. There is poor inter-rater reliability. It is based upon the individual opinion of the psychiatrist. It is subjective in nature, difficult to train people and varies between experts. Hence, clinical assessment has gone into a lot of criticism. Then came the important is actuarial assessment. That is the second generation. What is this actuarial assessment? It is a statistical method of estimating the risk of a particular event's occurrence with no significance given to the clinical skills and wisdom. Here, you will be assessing the base violence rate of a population. It may be general population. It may be persons with mental illness. Look into those risk factors. And if these risk factors occurs in a persons with mental illness, you will be telling, yes, this person has mild risk, moderate risk or severe risk. That means based on the base rate in the population and risk factors are predicted. Based on the risk factor, instruments will be devised. That means you are using an instrument to assess the risk. If you look at the number of risk assessment tools are available. The first very commonly used is HCR20, historical, clinical and risk management. So this is 20 variables are there. Based upon the 20 variables, you are going to categorize whether a person is moderate, mild or severe risk. Violence risk appraisal guide, psychopathy checklist revised guide, violence risk scale, sexual violence risk scale, violent assessment scale, sex offender risk appraisal guide, supposal assault risk assessment, structured assessment of violence risk in youth, general statistical information for recidivism, risk matrix 2000 for violence, the offender group reconviction scale, level of service inventory and revised version, psychopathy checklist. So there are various structured actuarial assessment guide is available. That means depending upon the need of the what type of violence you are assessing, depending upon the need, you are going to do the assessment. So this is using an instrument. It is called as actuarial assessment. Here, there is no role of individual clinician's requirement of his wisdom. It is based upon whether the person has the cutoff or not. So risk for other scales, there are many, as I mentioned earlier. So there has been various studies has been conducted. Those studies, I'm presenting here one of them. That is, in a psychological bulletin in 2010, the meta-analysis of important 9 risk assessment tool was done. This study clearly spoke about a different risk assessment scale, that is risk of violence to others. So these are the various which I mentioned. These are the scales which are there. What did this study say? This study looked into which is the best in assessment of violence. Can a good scale predict violence? How much predictive value is there regarding to violence? How accurate it is? How accurately it predicts violence in these scales was done, and a meta-analysis of various study involving these scales were done. What are the results of this? The result clearly said most of the instruments which are there to predict violence, it has a moderate level of predictive accuracy of these tools. That means it is not 100%, it is somewhere around 50 to 60%. And they should not be used alone. Just you are using this instrument is useless. They need to be combined with clinical assessment. And the selection of instrument plays a very crucial role, and what you are going to assess plays a very important role. So at the same time, who is assessing also makes a difference. So actuarial assessment requires certain important things. And you also need to know how much it is effective is one important factor, but also who is assessing this, whether that person is trained or not, what you are assessing, whether it is defined clearly or not, and what is the outcome you are looking for, and how long the prediction is done. That needs to be clearly known. Hence, you need to understand actuarial assessment looks very good, it looks very objective, but it has its own drawback. And by using just a scale or an instrument, it will give you a false sense of safety. That means it is not 100%. It was moderate predictive value is there. Risk assessment tools varied widely in the format, content, target population, purpose of duration of assessment, requirement of training, sensitivity, specificity, and various drawbacks were there. That means head-to-head comparison of the scale had a huge problem. Not only that, predictive value was very moderate. Hence, you need to understand this. That means using scale alone does not give you anything. It will give you a number, and it will give you a false sense of security that I have done the assessment. You need to combine along with the clinical assessment. Hence, the clear criticism which has been there for actuarial assessment is it is just a checklist method. It is there or not, you are just ticking off. It is empirically based, yes, but it is very mechanic. It lacks empathy. You are not going to treat a person as a human being rather than you are seeing a checklist. And it is, though it is considered as reliable and stable, it is only looks into stable factors. If there is environmental factors which is changing, imagine if there is, you have assessed a person telling that he is very stable, but suddenly there is a death in the family. Think about him. He may become violent. He may become, maybe have a suicidal attempt. That means you are not looking into the important factor, that is dynamic factors. Here, sensitivity, specificity is there, but you cannot predict violence. And here in the actuarial assessment, non-involvement of the claimant is the biggest risk and rarely used in clinical practice. That you need to understand, because this assessment requires training. Sometimes these scales are very small, maybe 1 page, 2 page. Some of them have 20, 30 pages, or else the assessment takes a lot of time. Copyright is there, you have to pay money, and above all these things, it is not 100% accurate. Hence, we need to look into the third generation of risk assessment, that is structured clinical judgment. This is the gold standard at this point of time today. So, what is the structured clinical judgment? The structured clinical judgment is also considered as structured professional judgment. Here, you are combining both actuarial tool assessment along with clinical judgment of the clinician. That means you will not only assess by using the instrument, you will also use the clinician's wisdom, clinical variables. You'll be talking to the patient, you'll be assessing thoroughly what are the risk factors, what is dynamic factor, what is static factor, what can be intervened. That means you're treating a person as a human being, as a holistic. That means it has some amount of predictive value, not again 100%. Actuarial approaches have been criticized for their lack of practical utility and do not give a scope for clinical wisdom and professional discretion. That has been the criticism of actuarial. Hence, structured clinical judgment gives a professional discretion, and clinicians see their role as preventing violence rather than predicting. These risk assessment scales just only predict. If you have a clinical acumen, clinical assessment, you are able to build a rapport with the client, that means you will be able to prevent the violence also. Hence, structured clinical judgment plays a crucial role that you have to keep in mind. So let's understand. Clinical assessment unstructured, that is the first generation. Second is actuarial, using only the instrument. But now the third generation is structured clinical judgment. That means combination of both should be used to do the risk assessment, but it requires time, it requires assessment instrument, it requires some amount of training and also wisdom. Let's look into the review of this. It has both worlds of clinical and structured assessment of the risk. That means it has generation 1 and generation 2 combining, it becomes generation 3. And you are going to choose the right scale, and a trained professional will be doing the assessment. And to assess the risk thoroughly, you have to do repeated assessment over a period of time. And if required, parallel opinion need to be sought by your colleagues so that you are not going to miss anything. So risk assessment, you need to understand that. And it is an objective assessment, both structured clinical judgment, and you are going to use this risk assessment to distribute the scarce resources. Suppose a person is highly violent, you are going to admit either in the ICU or high intensity monitoring unit. That means you'll be providing more of security to him, more nurses will be available, so that you'll be utilizing your scarce resources for that person. And by doing this, you're enhancing the public safety, and you'll be intervening the relapse and the worst outcome. And uniform standard of care can be provided across the country, and it improves the communication and knowledge transfers and reduces the error. That is the need for risk assessment. So risk assessment is required for objective assessment, to diverting the scared resources for this person who is at high risk, increasing the public safety, and you are providing the relapse prevention can be done, or else mitigating the risk. Uniform standard of care, you are able to communicate to the people, yes, he's at high risk, and also you can transfer the knowledge and also reduce errors. And when you do risk assessment, please understand, take all threats seriously and do a detailed assessment. The detailed assessment you should know is how he is going to carry out this act, whether he has planned it, what is the anticipated consequences, whether he knows why he is doing it, what is his comprehension, whether he is able to understand the nature of his act, what is the consequences of the act, whether he knows that it is against the law, whether he has a potential grudge, whether he has a list of people whom he is going to take revenge. So all those important factors need to be assessed. At the same time, you need to assess for suicidal risk and also find a standardized instrument like HCR to assess the risk of violence. And you need to have a written SOPs. If you have done the assessment and you come to know this person is highly risk for violence, that means you need to have a written standard operating procedure where you are going to keep him, what is the manpower, what are the medications you are going to give, if you are going to give ECT, what you are going to do, if you are going to take informed consent, where you are going to take, if the patient refuses to give consent for treatment, then where you are going to ask for permission, whether it is a mental health review board or else a independent judicial body you are going to ask. So those standard operating procedures should be available at the treatment or for the crisis management team. At the same time, you need to minimize the cultural bias. A person who is assessing, you need to be free from cultural bias, religious bias, and also racial bias. There has been various study which has been conducted. If a white person who is doing and risk assessment against a black, invariably, it has been found many a time the risk assessment shows higher risk. That means this kind of cultural, racial bias need to be decreased as much as possible. That calls for a training of the professional that we need to understand. And we need to mitigate the risk. The best way to control the risk is to ensure there are effective, regular monitoring of the staff. And you need to detect the early signs of relapse, ensure there are adequate resources available to mitigate the risk. That means you are not just assessing the risk. At the same time, you need to have appropriate resources, maybe medication, maybe security, maybe closed ward, enough of number of beds, enough of number of nurses are there, and also counselors are available. That means you need to have resources when you do this risk assessment. At the same time, pharmacotherapy can be used judiciously to prevent violence. At the same time, you will also do psychological intervention. Whenever there is a risk assessment, you are going to take 2 or 3 important things you have to understand. First and the foremost is prevent violence. Second one is avoid violence or avoid this risk situation. De-escalation should be done. At the same time, if these are all not available, you will be using restraint as the last resort. Before that, you may use pharmacotherapy, you may do some counseling, then only the risk management, other strategies can be used, maybe restraining. But if you are doing, please follow the legal standards which is applicable at this point of time. Now let's understand risk assessment. What are the limitations and challenges? First and the foremost limitation. You need to have a trained mental health personnel to do this risk assessment. Without a trained mental health professional, this risk assessment is a sham process, either by ticking the checklist, without having a good proper management, without knowing what instruments to be chosen, why we are doing this, how we are doing this, where we are going to implement. Without knowing that, it is useless. That means training should be mandatory for the people who are going to work in a highly risk situation. That means you need to have resources, human resources, financial resources, infrastructure. At the same time, SOPs need to be available. At the same time required for assessment and documentation is huge. That means you are spending a time and meager resources for a person who is at high risk. And this is a risk assessment, is a task specific, and you need to have a specific instrument to do this assessment. And also, you need to have a good information available. If you don't have information, that means risk assessment, whatever prediction you are going to do or the risk assessment will be very, very low in its intensity. Information can be manipulated. Sometimes the patients can stop medication if it is you're doing assessment in the community. Substance abuse, drug abuse, if he's using and he says, I'm not using, these are all the limitations of the risk assessment. At the same time, violating the treatment advice or avoidance, these are also a possible, but he says, I'm taking medicine, but when you do the blood test, there is nothing available in the blood with regard to those medicines which you have prescribed. That means risk assessment comes with limitation. The limitation is the quality and the quantity of the information you are going to get. That means consistency, reliability, validity, and whether you are able to understand this information. How many people have validated this information about the person whom you are assessing the risk? If you don't have any information about the person, that means risk assessment is very, very poor. And also, please understand, the risk assessment is short-term, cross-sectional, and a snapshot of this event at this point of time. Risk assessment for long-term is useless and it cannot be done. And as possible, multiple assessors should be used to minimize the bias, and the person need to be trained with regard to using the instrument. You need to keep the cultural bias, racial bias, religious bias. And please understand, prediction is never 100%. What we are doing is risk assessment, categorizing the person either is a mild, moderate, or severe risk. And please understand, predicting a human behavior is completely difficult and it is impossible to predict a human behavior. Only we can do probability, the risk assessment. And also, it is impossible to identify and eliminate risk completely. Only thing is, we are able to eliminate or minimize the dynamic risk factor. Even in the best of the circumstances, using all possible resources, all trained persons, the assessment is moderate. That means you'll be able to assess or predict maximum 40 to 50%. And even if you do a good risk assessment, you cannot prevent adverse event because doctors are not God. They are human beings. And we are assessing a human being, which is still another complex. That means risk assessment is to minimize the likelihood of adverse outcome. Using a risk assessment just for a reasonable degree of care. Risk assessment does not mean you are going to 100% prevent violence. Impossible. Risk assessment is basically to provide reasonable degree of care. That has to be understood not only by the clinician, by the policy makers, by the judicial officers. The people who are sitting in the mental health review board need to understand this. Risk assessment is just a method. It is not going to prevent 100% violence or 100% suicidal attempt. So that means we are giving a reasonable degree of care. This requires time and resources. Without adequate resource, risk assessment is useless. After assessment, there should be a good system to communicate. Yes, I have done the assessment, he is risk. From one shift of nurse to another shift, we need to communicate. Yes, Mr. X has a moderate or severe risk of violence or death by suicide. That risk needs to be communicated. Not only that, there should be standard operating procedure in place if you are assessing a risk and you are going to mitigate the risk. And training of all stakeholders, including family members, relatives, caregivers, and more important, judicial officers. The members who are sitting in the mental health review board need to understand risk assessment is only to provide reasonable degree of care. It is not going to prevent either the violence or a person who is going to attempt by suicide, because we are able to intervene only the dynamic risk factors. The static risk factor, none of the doctor or none of the human being is able to prevent this. To conclude, my dear friends, to do the risk management and assessment, screening of a person who is at risk, we need to be screened. Thorough evaluation of the risk assessment has to be done. Analysis of the risk. Communication of the risk of a client need to be done to the nursing staff, security, and the other doctors need to know. And you need to prevent the risk by shifting the patient to ICU, high security monitoring unit. And to do this, sometimes you need to do de-escalation, avoiding the risk by removing the weapons, medications, and those things has to be done. And also you need to find the person who is the victim and minimize the access to that victim by the person with mental illness. Pharmacotherapy, psychosocial intervention, and increased supervision has to be done. So these are the goals of risk assessment. To my final words, my dear friend, risk assessment is a one way of mitigating the risk, but it cannot prevent violence 100%. Thank you very much for giving your valuable time. Stay safe.